Tracy is a very good friend of mine. We have been friends for a long time over here in Okinawa. He has spent most of his life in Asia. He lived in the Philippines as well, and he lived many years here in Asia. So I consider him as the Tracy Lee Chan, not Tracy Daniels, Tracy Lee Chan, or Tracy Matsumoto, or Tracy Nawahara, because I count him as one of my very, very good close Asian friend as well. Um, Tracy is now based in Florida, and I think he's one of the psychologists, or how do you say, a counselor with the Bay Care Center.
Yeah.
Here, Tracy will probably explain more on that later on. But he has done a he while he was in Okinawa. Also, he was a counselor, and then he took care of almost 40,000 people, giving care, and then a lot of counseling, debriefing, clinical tests, well, whatever you call. He does all those kind of things. And so, besides him being a counselor and being a psychologist, he's a great, very, very good singer. And so we have produced two CDs together, and he was my singing partner until he decided to just leave me behind and then go to Florida. You need to get back to Asia, to Okinawa, to sing together. But we have led worship together in many of our conferences, congresses as well, and we have had a very good time going out during the Japan tsunami, also going out and then singing and then giving care to people. And so, just being very blessed to have him here. I would like to just call upon Tracy to come and then take your time.
Thank
Thank
you.
you for being here.
You're welcome. Thank you, V. Thank you for inviting me, everybody. I'm glad to be here and to talk about this subject because this is a subject that I know that is affecting people globally. And when we start talking about stress, anxiety, we start looking at mental health. I think it is something too that as the church deals with it more and more, we're going to really have to find out how to help, our parishioners and even those of us that are in ministry, from the pastor to the bishops, how to help deal with this subject. And when I start talking about this subject today, it is one that I deal with constantly, as V says. I am a clinical psychologist and I work out of 7 psychiatric hospitals here in the area that I'm in Florida. And I also serve on a team where I do critical stress debriefing and critical stress management, where I travel extensively and work with all different types of people that are suffering with mental health. And especially, I work closely with law enforcement and first responders. So today, when I talk about this subject, I'm going to preface it a lot with what are the things that we're seeing globally since the pandemic has happened. Because there are a lot of things that were going on before the pandemic, but now that we're in a pandemic, those things have increased. And from being a psychologist and working in a private practice with people, I see a lot of things. And globally, I have studied it because a lot of the people that I deal with that come into our hospitals, they're not from America. We do have some, but we do get people oftentimes, because of the area that I'm in, that we have a melting pot of a lot of different people. So we want to talk about that today. But first things first, I want to kind of caveat on what is the disorders that people are suffering with. Now, when we talk about these, I want to not just talk about a person that has a disorder, because I believe truthfully and honestly, people are experiencing symptoms and not necessarily disorder because of everything that's going on. And so when we look at disorders, these are some of the things, and we look at symptoms. So I'm going to caveat it in two different ways. But when we start looking at them as a whole, what are we really dealing with globally because of this pandemic? And for so many people, the uncertainty surrounding the corona is the hardest thing for people to handle, because this was something that we didn't ask for. This was something that happened. And if we study data and trends, we can see here, even in the US in 1918, we had the Spanish flu and it lasted for about 4 years. We see this pandemic is now what? We're in our first year and we're going to be in it for a little while. And we don't know exactly, the impact or how bad things might get. So it's creating worry. And it's not just people that are not in the church, it's everyone. And so understanding, how to deal with this where we're not catastrophizing and making it worse and living in fear, because we know the word of God tells us in Philippians that we're not to what? Do not be anxious for anything. So we're not to have this part of anxiousness, even though anxiety is something that we all live with. But how do we not allow it to become overwhelming? And now it begins to cause us to have panic. And I think of it in these ways too, is how are we managing our levels of anxiety and stress? Depending on the day, or sometimes even higher, depending on what's happening in our life. So how are we dealing with stress? How are we dealing with the fact that we might be, balancing anxiety symptoms? We might even have some depressive symptoms. How are we doing, and how do we understand them? And when we look at the interruption to our normal way of doing things, that's what's happened. We are in a season of change, whether we want to agree with it or not. But the key thing that I have been talking about, and I've done numerous webinars and podcasts and talked to a lot of people about this subject, and that is understanding that what we call normal, it's not there anymore. So when we look at normality, is how are we going to move forward in this new season that we're all living in globally? What does it look like, and how do we embrace it? And we see that COVID has disrupted and interrupted our lives, and even within the church, because we see that churches cannot congregate the way they used to. Some churches are beginning to be very innovative by doing services in different ways. And also, we see that there has to be a mindset change from the leaders and how to reach people now. And that can really affect a church and affect the leaders. Since mid March of 2020, global economics, cities, communities, and churches have been completely disrupted. And how do we deal with it from a church mindset? How do we deal with it from looking at communities and economies? How are we dealing with it? We see how people globally lived prior to March, mid-March, came to a complete halt. It really did. And we have to learn now how to balance ourselves through this process of the pandemic. What does it look like? What doesn't it look like? How is it affecting my ministry? How is it not affecting my ministry? How am I now beginning to help my people within the communities, within the ministry, to really begin to focus on the things that we need to do and go forward? How will we focus on God during this time? Because see, those things are affecting people. How am I believing in God and trusting in God? Especially if I've gotten the virus. I actually had the virus, and it was really severe. And how do we put our trust in God when we are dealing with it and it is depleting us? How do we share that with our members who might have gotten a virus too? What are we doing? And I think these are things that are important as we move forward in this pandemic globally. There's a phenomenon that has happened globally that people are experiencing, and it's called cocooning. And as I started studying it and looking at it, it's different in different countries, but it goes back to the fact that now people were forced and are forced to stay into their homes, and they've never really paid that any attention until now because it disrupted people's routines. And so when people got out of their routines, it really began to affect them and how they were living their lives. So we see that cocooning deals with us now coming back into our homes, and now our homes are becoming the focal point and how we have to deal with ourselves. And when we look at this heart study of 2020, it talks about how the pandemic is creating more social and generalized anxiety disorders. And we look at symptoms also. So these are things to talk about. I'm going to spread and talk about a little bit about these, but these are things that's going on in our society. What is happening? Are there more numbers for depression? Are there more numbers for anxiety? What is really going on, and how are we paying attention to these things? I know one of the studies that I looked at as far as research, there was a 200% increase in alcohol sales in the first 2 weeks of March. Churches were told to close, but liquor stores were allowed to stay open, especially here in the United States. And that in itself created a lot of problems where people were using alcohol as a way to self-medicate because of what was taking place during the pandemic. So these are things that we talk about and begin to understand. So what are some of the new lifestyles that people are living in since COVID? And these are some of them: pantry living, quarantine living and restricted living. And we know that how people are now buying things and how people now are refusing to go outside the homes. We see these things and it's creating these styles of living because people are living in fear. And we know biblically that's how the enemy wants to come in to attack us because God says that perfect love casts out fear. So if we're living in fear, then we know that that's going against God's word. So we got to help people understand how to combat fear. We got to begin to help people really realize who God is as Jehovah Shalom, the God of their peace, and begin to help people live in peace and understand how to gravitate to God during this time when we are experiencing some of the symptoms that might go to a mental health disorder. So these are the things I talk about and look at, but I want to break them down a little bit further. We talk about spheres of influence. So one of the key factors that I really help people to really kind of understand when we start looking at emotions. I did a PBS special not too long ago on secondary grief and bereavement and trauma, and I talked about it not just here in the United States, but I put backdrops on it globally. And one of the things that I was looking at and doing research was understanding how people's emotions have to begin to really go with how their behaviors are displayed. So we see naming your emotions is very essential during this time because if I'm feeling stressed, if I'm feeling worried, if I'm feeling fearful, if I'm feeling lonely, overwhelmed, I want to make sure that the behaviors are going along with the emotions. Because if I'm naming an emotion and it's not going according to the behavior, then it's going to cause me to be in confusion within myself. So very, very simple. If I'm feeling overwhelmed, what behaviors do I notice? Not anyone else. What behaviors do I notice that goes along with my feeling of overwhelmed? If I'm feeling stressed, what psychological, physiological, and then also physical emotions, what physical behaviors am I paying attention to that go along with my emotions? That's how we begin to understand and help people who are going through secondary griefs identify what's going on with them. Because when we identify secondary grief and the stages of it, it really brings people into understanding that the secondary grief is going to be secondary to the main grief that's happened in my life. So, for instance, if I have somebody who passes away, a family member, that's the main grief. The secondary griefs that's going to surround itself around that could be what? Me not being able to provide for the funeral, family members not in agreement with what's taking place. Also, now I might have to move out of my house because the person who passed away was the breadwinner. So those are secondary griefs. When we start looking at that part of trauma, those are the things that affect people. And now they begin to group them together and their focus gets off of what the number one grief was. And now the secondary parts become instrumental in their life, which now begins to affect them. So when we look at secondary grief, this is what we're talking about and helping people understand how to balance themselves through that. And the thing too is remembering that it's okay to feel discomfort. It's okay to feel this way. Accepting the distress is often the quickest way to feel and to immediately become calmer. So now I'm going to begin to identify. We was listening earlier, and we were talking about the stages of grief. Dr. Kubler-Ross in 1969 is the one who penned this title. And when we look at the stages of grief, which is 5, a person can come in any of those stages, but it's helping them to understand what stage they're in and helping them to understand how to work through those stages to get them to the area that's going to be effective for them. When we start talking about secondary griefs, these are the things that help people understand also where they at in the grief process. Are you in bargaining? Are you in denial? Are you in acceptance? Are you in depression? Which style, which one of the stages are you going to be in? Because a person can come in any of the stages. They don't have to start with the number one, which we know the number one is denial. Then we look at bargaining, we look at anger. So it's being able to understand which area of grief they're coming into and then helping them understand how to balance and move through those. Because for some people, it could take a year. For some people, it could take 6 months. It depends on the person, and it also depends on the severity of the grief that they're balancing. So these are the things we talk about. And I want to hit on a little bit too when we look at what's the number one disorder when we look at it globally. Most people think when we talk about disorders and even symptoms, they think that depression is it, and it's not depression. when we start talking about the number one disorders, number one disorder globally that's affecting, we look at these numbers. So honestly, when I looked at the World Health Organization and Harvard University, there are studies that came out in 2017, and now I'm waiting on new data that's supposed to be coming out in actually June and July of 2021. We see that 792 million people in globally are affected by mental health. The number one disorder that people suffer with when we look at disorder is anxiety disorders. It is not depression. So we see that 3.8% of a population globally are affected by anxiety disorder compared to 264 million people that are affected by depression, which actually comes to 3.4% of a population. So we see that. And now the number three disorder that people suffer with is substance use disorder, people battling with substances. And globally, we see that also because substance use is 107 million globally. Then we look at 1.4% of the population. So we look at those numbers, and when I break it down per gender, for depression, 2.7% males compared to 4.1% of females that are affected by depression. When I look at anxiety, it's even higher, 2.8% of males versus 4.7% of females that are affected by anxiety, which once again, anxiety is number one. And when I look at alcohol, 2% male and 0.8% female. So we see males are dealing with more alcohol than females, but females are dealing with more of anxiety and depression. So when we look at the global part of it, these are the things that's affecting people globally. When we start breaking them down, once again, I say it like this from being in the field and being a psychologist, you got more people that are suffering with anxieties than you do depressions, but it does not mean that they have a disorder. Any of us can fall victim to symptoms, and that's what we have to watch and pay attention to. When I talk about it in that way, it's understanding the levels of our auto stresses. When I'm going through and I'm trying to balance myself, I'm suffering from high levels of stress. These are can be triggered by the pandemic. But people might continue to feel this way even after the virus is gone. So we got to watch what will take over into the next season. So if I'm feeling tightness of chest, I'm feeling like I can't breathe, stress, it can create that. Muscle tension, aches and pains, these things are stress. So I want to watch what I'm doing so I don't carry them over into the next season. Headaches, heart palpitations, which can be panic, the digestive issues. So we see these things. Being able to understand what they are and what they're not is important as we enter into this next season. Also, how is anxiety unhealthy? When we look at anxiety in and of itself, as I said, anxiety is best described as unhealthy thinking patterns. These are things that we experience and our mind fixates on the threats, uncertainties, and negativity. And I don't, look at it versus the church versus not, because people are people, but it's understanding from a ministry, how do I see these things in my parishioners, and what do I look for? So we look at anxiety. They can occur, on its own or as responses to stress. So if we think about this, last year, this time, we were just kind of really ramping up and getting into this virus. But people were still not taking it serious, just like some people aren't today. But what is my response to the stress? How is it triggering stress in my life? And what's my reaction to it? How am I dealing with it? Am I paying things attention that I didn't not necessarily do? Or what am I looking at? How am I recognizing what's taking place in my life? And if I'm not, then I need to see how to balance this. My emotions, what's going on with my emotions? Am I more sensitive? Have I become more irritated or irritable with people? What am I doing? What am I not doing? So we look at the church, and these are some of the things that I really kind of key on when I see the church is from March 2020 to January 2021, 63.9% of individuals worldwide have sought help for mental health problems. 63, almost 64% of people have. Prevalence rates were slightly greater among women as they were men, as we see according to the Albert study. So we see 54.9% for women, 45.1% for women. And these are the things that we begin to see. I'm sorry, 45.1% for men. So these are the things that we start to see. and how people are affected by mental health. And I put it in these terms. When a person has cancer, one of the things that we do with cancer is that we kind of look at it as it's not the person's fault, it's something that happened to them, which is true. But we will take time to be around them, to love on them, to, actually take them to chemo and things like that, because it is something that they didn't ask for, and it's a cancer, and it is a disease. When I talk about mental health, I say it in the same way. It is a disease that a person didn't ask for. It's something that's in their life. So we have to begin to change our mindset on what it is and what it is not, because it's the same thing as cancer. It's a disease. And we have to begin to help ourselves understand that when somebody's battling with mental health, even with symptoms, and we begin to see them played out, we got to begin to understand how to help them through the process. We see churches will have to navigate a deeply divided culture with deep trust issues, because now, because of what's taking place with the pandemic, people are affected by trust. Who do we trust? How do we deal with this? The pandemic is this way. I've had a family member lost their lives. Who do I trust? Church members are experiencing greater numbers of fear and worry. And we know that because that's what the enemy has unleashed globally. When we start looking at fear and worry, the number two disorder that people suffer with, when we start looking at them, is social anxiety and then generalized anxiety disorder. So we know the number one disorder is specific anxiety. That's number one globally. Number two, we start looking at is social, and number three is GAD, generalized anxiety disorder. And the precursor, when we start looking at what makes up GAD, it is fear and worry. So those are the things that you're listening for. If you do have parishioners that are talking, you listen to see how is their fear and worry, because now it gives me an understanding that they could be having symptoms of someone suffering with generalized anxiety disorder. Isolation and separation has created a lack of empathy and compassion, and that's true. People are separating themselves. That's why I talked about cocooning earlier, because that's what's happening with people. We see this part too when I start identifying psychological and emotional reactions to stress. People having difficulty sleeping. I normally ask the question is, how many hours of sleep are people getting? Because if you're getting less than 4 or 5 hours of sleep, then it's going to affect you, because what happens is your brain, your prefrontal cortex, stays in a fight or flight stage, which is where it affects us in our concentration. And when our prefrontal cortex is affected because we are in a fight or flight stage, it doesn't allow us to be able to get into an area where we can come at a calmness and a peace. That's the reason why people who are suffering with mental health and actually dealing with symptoms, their sleep patterns are off. We talked about worry, sadness, fear. All these things are in there. Depression and inability to concentrate. So I always talk about these and help people understand how to get through them. So I want to look at some examples of what to look out for. Because when you're dealing with people, you want to be able to identify what is it that I need to listen to what they're saying, even in the church. What am I listening for? So you're listening for people that are threat scanning. And that's when a person's mind searches the environment and they're living in fear. Okay? So these are some of the things to pay attention to. Frequently checking their bodies, and they're talking about this, or they're obsessively checking family members or pets for the virus. So that we look at that as threat scanning. And it's associated with the mind assigning meaning to events. And you can hear people talking about that, okay? Catastrophized thinking. That's when a person's mind jumps to worst case scenarios, and then they start making a mountain or a molehill. My chest feels tight. My mind tells me that I have coronas and that my life is in danger. But if I'm practicing all the social things that I need to, as far as social distancing and wearing a mask, then how am I dealing? How am I going to get it? My mind gives me the mental image of losing all the people I love, which once again is what? That's making a mountain out of molehills, because that's not the way that it is. Emotional reasoning is when my mind tells me, and then reflects unrealistic thinking. So now I have these things that are not reliable. So I feel scared all the time because I breathe the virus in my sleep. Okay, come on. That once again is not realistic. I feel guilty, so I must have done something wrong. So all these things we look at emotional reasoning and fortune telling. That's when my mind interprets predictions as facts. So example, I'm going to be stuck inside for 10 years because of the virus. We know that's not the case. We'll also look at I can't go outside anymore because the virus is everywhere, even in the trees. So these are the things we have to go back and really listen to what people are saying in the church to help us identify how to get them to the next level of care and to help them through the process. I think the biggest one is this one right here, and this is hypothetical worries. And I preface it in a way when people deal with hypothetical worries, they live in the what ifs thoughts. What if this? What if that? How is this? I can't do this. I can't. So, what if this happens? Hypothetical worry is the worst. We want to identify our practical worry because practical worries are the things we can control. Okay. So, what are the things I can control? I can control my sleep. I can control my diet. I can control if I'm going to go outside. The things I can't control what my neighbors are doing. So we'll look at some examples. I know I'm following all the guidelines, but what if I spread the virus? So if I'm following all the guidelines, how am I going to spread the virus? That's a what if. That's unrealistic. What if someone gets too close to me at the supermarket and I catch it? Okay, could be. But if I'm practicing everything and I'm using social distancing, then I know that's not realistic. So when we talk about hypothetical worry, these are the big ones that we have to pay attention to. And these are just some of them. You know, you cannot stop hypothetical worries from occurring, but you can control how you respond to them. And that's the key thing and how to deal with it. Because I believe truthfully, when the Holy Spirit gives us the unction, God is going to help us process this. So the things that's in my control, I need to focus on. I can control my exercise. I can control, who I'm going to get information from, my diet, focus on what's important. I can control those things. But what I can't control is the opinions of other people, what the government is saying, what my neighbors are saying. I can't control those things. So I'm not going to live in those things. And that's why we have to identify our practical worry versus our hypothetical worry. So these are some of the tips that we look at to reduce anxiety and even help us balance. When we talk about the secondary grief, this goes into that also. Captivating our gratitude, really understanding how gratitude has a plethora of benefits, including reducing stress and anxiety, boosting our mood and strengthening our immune system, and actually improving our sleep. So now we're gracious. That means we're living in peace. We got to work on being kind to ourselves. Self-care is so important during this time. And how to balance our self-care. What is our resiliency like? Am I dealing with resilient behavior? If I have a lot on my plate, I got to understand how to remove some of that stuff. I don't want to be my wrong worst critic of myself. I want to use positive affirmations to help me through this process. Why? So that now when things begin to come and I feel overwhelmed, I know how to deal with them because I'm putting the right emotion with the right behavior. I got to get that sleep. I can't stress it enough. Sleep is so instrumental because it brings our thoughts, it brings our body, it brings us into a balance with ourselves, and it actually brings us to an area where now we're able to process stressful events, and we're also able to process them and deal with them in the right way, especially if we're going through secondary grief, because with secondary grief, sleep is one of the first things that's affected because people's minds are racing. That's anxiety. Can't shut their minds down. Always thinking about the incident. That's why when I'm teaching it on the academic side, especially when it comes to depression, whenever somebody's battling depression, they always have anxiety. And the way we know that is because even with depression, they can't shut their minds down. They're racing. They're thinking about that situation and they're living in it. And it's constantly like a movie being played. So we got to get our sleep to help us balance it. So as I close, these are some of my references that I have used to talk about this subject. I'll leave them up. And if there's any questions that's there, you have anything in the chat box, let's open it up and let's talk about
it. Okay. Thank you so much for that. And that was really a lot of stuff, a lot of information, a lot of depth. I think we might need a little more time to process a lot of what you said, but some great things. Thank you so much. And we also have some excellent questions that have come through. Interestingly, I mean, I'm not going to put the poll out, but interestingly, from the poll, not very many of us on the group seem to be feeling too anxious. So that's a good sign. But however, we do have some interesting questions.
Okay.
One question is, how can we as ministers be open about our own anxiety? Because I guess it's also another secondary grief almost, the fear of being judged by your congregation or those whom you serve if you say that you are in this situation. And I think that's one of the big issues that we face as ministers in the situation where we are able to be vulnerable. So what do you have to say about that? How can we set about that?
That's a good question, because I present to ministries here in the United States a lot in reference to mental health. And one of the things I always talk about is being able to be transparent. One of the things about helping our congregation and helping people is understanding how to. And if I'm going through as a leader, I have to remember that the people are going to be doing what? They're going to be experiencing the same thing I'm going through with too. And because I'm a leader does not separate me from being human. So one of the things I share with leaders is if there's things going on, it doesn't mean you got to go blast it across the congregation. That's not what I'm saying. But if there's things going on, be able to set a conversation around what's going on and how to balance it. Because anxiety, if I'm experiencing anxiety, there's nothing wrong with that, because everybody experiencing anxiety. It's just, how do I deal with it where now I'm being open about how I'm going through? Because when we start dealing with people, one of the first things I always say is we got to remember to be what? To be transparent and not try to hide anything. Because if we try to do that, it's going to come out. And if I'm experiencing something, let's talk about it. Like I said, it doesn't mean I need to blast it from the pulpit, especially if I'm a minister that's up talking. But what I can do is develop a narrative around it. We can do some small groups and just open it up for conversation. But I believe it's important that we do start talking about mental health within the church. We have to, because people are suffering. I did actually a podcast for Charisma Magazine, and the podcast was on clergy that are suffering with anxiety and also suffering with depression. And then we looked at congregation, and I know when I start looking at it, and look globally, but I talked about the United States, 68% of the congregations, the people are suffering with mental health, and they want the pastors to talk about it so that now they can be what? They can be open about what's going on. So I think when we start looking at it from a church standpoint, we got to put these things on the table so that people understand that we're human just like they are. Even though I'm a leader, but it does not stop me from going through problems just like you do. And so that to me is so important, is being able to have conversations around it, and open it up for dialogue. Because I don't really think, truthfully, that mental health is really talked about in the church. And I know it's not, because I talk about it a lot, because I teach an 8-hour class to help people understand how to recognize every mental health disorder that's out there. And so I think
Thank
that's
you. Yeah.
Another thing I would say this is helping people understand what is symptoms versus disorders, because that's very important. What is a symptom versus a disorder? Because any one of us can operate in a symptom, but it doesn't mean we have the disorder.
I think that's a very important point. On the question around that about being vulnerable, the flip side of that is where we as ministers, and that was a question that was being asked, and I believe you answered some of them in the first part. But is there anything more in what we can do to actually cultivate a culture of vulnerability when there is a stigma around it, where weakness is there's stigmatization on that, and particularly when it is ministers of the gospel who are expected to be almost superheroes at times. So how do we amongst our own selves cultivate that culture?
Yeah, I like that question, because you hit on a key fact, that is stigmas. Because when we look at stigmas, and I say this to any and everyone, I don't believe anyone is crazy. I don't believe in that, because everybody in life has issues. It doesn't make us crazy, it makes us human. And in the church, we got to understand humanity. That's why God has called us. When we look at the gospel, Jesus, he said he didn't come for those that were what? On that area where they were puffed up. He came for those that were sick. And Jesus was vulnerable. He allowed them to see his weaknesses. Why are we so afraid of allowing people to see us in situations where what? Where we might be vulnerable? Why are we afraid of that? And I think when we start addressing it, even dealing with what? The stigmas, I take it back to this one thing. When we are talking about it from a transparency way, it's being able to talk about it not from the way where we're passing judgment, but from the way where we're providing education. That's so important. How are we educating people to understand what it is and what it is not? Example, when someone says they have anxiety or depression, one of the things that we hardly ever do is ask them what kind. And it's important that we understand because there are over 15 different kinds of anxieties and there are over 15 different types of depressions. That's important because any one of us can operate out of symptoms. So to answer that question, if I'm working within a ministry as a minister, as a pastor, whatever my office is, one of the first things that I must do is allow the people around me to see that I go through just like they go through. I'm not trying to hide anything. I'm going to be open. Now, that doesn't mean that I go and blast all of my business. That's not what I'm talking about. But just to be honest, that if things are going on, we can have dialogue around it. And I put it in this way: there's nothing wrong with having little like the small groups and breaking up conversations. To have these conversations around it and to be open with people. I think that's so important as ministers because when people can see our vulnerability, it helps them to understand that we are human just like them and we're not on this pedestal. We're not superhuman, that we hurt just like they do. Jesus said it. In every way, he was tempted as man, but what? He was the only one who didn't sin. So we have temptations. But we have to understand how to allow our parishioners and those that are on that we serve to see that we're human just like they are and open it up for dialogue and not be afraid or ashamed to share with people how we are. There's nothing wrong with that.
Yeah. There was, a couple of questions that came in around guilt, and there was also a question asked in the previous session around that. But
Yes.
around, again, linked to this whole stigmatization,
Mhm.
how do we, again, overcome or cope with that silent guilt that we might feel and that feeling that comes across at times that we don't feel adequate to be able to, listen or to serve our members?
Wow. And I heard that question too. When we look at guilt, what is guilt? Guilt, once again, is an emotion. So now I'm feeling guilty. I think I put it in this way: who do we have over us that is mentoring us? Who is my mentor that I can go and talk to and share these things with, and we have dialogue? Another study that I looked at, and I did see this globally, we see that 48% of pastors, leaders, do not have a mentor over them that's speaking into their life. 48%. If I'm going through something, I got to have a mentor that I can go and talk to that can give me guidance in how to deal with me. Because listen, we go through situations, people are not easy to deal with. Let's be real, they're not. Especially when we're in ministry and we got people that's in ministry that's coming with all type of things. And if I'm going through myself and my self-esteem is not good, I got to find somebody that I can speak to that can help me, that can mentor me, that's actually used that has gone through, has wisdom, has been in this, and can help me balance myself. Because why? We're gonna have those times when it's just not going good. That's life. We're gonna have difficulties, setbacks. We just got to understand how to balance them. But to answer that question, I would say the most important thing is to understand that guilt is emotion. Let me begin to break down and question, why am I feeling this way? And then discuss it and talk about it with who? With a leader who's over me, who's my mentor. Got to have somebody that speaks into my life that I can share things with, and we can talk about this, and then they can help me understand how to balance it within myself and work within my congregation. That's so important.
Mm-hmm. Yeah, I mean, when you talked about emotion, I'm reminded of kind of a saying that somebody had put together, that even though Jesus knew that Lazarus,
Yes.
when he got the news, he cried.
Yes.
He knew that Lazarus was going to be raised up, but he still cried.
Yes.
He knew that death was not the end, but he still cried. And it's that level of being able to express that emotion in that
Yes.
moment and not to hide it. And I believe that's something very, very important that you said.
Yes.
Another question that has come is, if I am experiencing symptoms of anxiety,
Right.
it may not have gone into the line of disorder, but
Mhm.
how could I actually diagnose myself? Is there some
Yes.
mechanism, some formula that I can objectively use to
Yes.
determine where I am on that scale? Because as pastors, we see people showing those symptoms of anxiety, and how do we sometimes respond to that? How do we work around that?
Right. 6 very simple areas, and I teach this: thinking, emotion, and behavior. Okay. So now I'm paying attention to myself and how if I'm in church, if I'm working, or if I'm in school, those 3 areas, I can tell if my thinking, emotion, behavior has changed. I can tell it in my personal life and how I'm changing my personal life. And now I can look and see how it's changing my daily activities. So these things I can actually test because I can see these things. So now if I'm not speaking the same way and I'm changing, I can see that in my emotions and I can see that in my thinking. If now my behaviors have become isolative and I'm not doing the same things that I used to be doing, I can see that played out in my behavior. Now my daily activities are not the same. So now I'm not doing the same things I used to. I'm not enjoying the same things I used to. And I'm not even being around the people. I can see those things. So those areas are the things that I'm using to help me understand what's going on with me. So now my thinking, emotion, behavior have changed. Now, let me say this to you. Those are very important because I can see these played out in other people. See, this has nothing to do with nationality. This is in everybody. So if I'm working around somebody and I notice that their thinking emotion has changed because I can see it played out in how they're coming to church, how they're working, I can see it played out in their daily activities, plus I can see it played out in their personal life, then that gives me an opportunity to know something is not going well. And that's even with me. So those are the ways you begin to tell it. Those are the tests that you begin to do on yourself because you can see that. So now I'm a little bit more emotional than I used to be. That wasn't me. Now I'm not able to get into the peace I used to be. So now not only am I a little bit more irritable, now I got things I'm saying back to people that's changing my character. Now I'm noticing that I'm doing a lot of sleeping and I'm not wanting to be around people because I'm irritated. I can see those things. Plus, I'm not thinking the same things anymore. My thinking has changed. Thinking, emotion, and behavior. We can see those things, and that's how we begin to pay attention within us also and within other people.
Yeah. There was a question around the danger signs, but I think Dr. Tracy answered that about thinking. What are the three? Thinking, there was something in between behavior.
Thinking, emotion, and behavior.
Thinking, emotion, and behavior.
Yes.
So there was that question about the danger signs. So I guess that would be some of those danger signs. But at the same time, within our church context, we tend to almost have a mantra to be able to say, if you're in a situation, let's pray about it. And we seem to be praying too long for healing without actually referring someone for help, and almost seeing that as not really something spiritual that we should be doing. But is there a guidance that you can give us to know, okay, beyond this point, you really need to get some additional help? So as people in that ministry, what is that point? How do we recognize that point?
That's a very good question. So it goes into this area. When you see it lingering and lingering and lingering, so now it turns into 1 day. Now it turns into 2 days. Now you're seeing it turn into 3 days. And I tell people this: anytime it goes past 4 days, that's when you want to get the person some help. Plus, I'm looking at what? Acuity, which is the acute phases of it, and then the severity of what's taking place with them. So let's talk about grief. So now I notice somebody might have a loved one that passed away due to COVID. So I notice automatically, I know that they're going to be sad, they're going to be down. I know that. But when I notice it now, thinking, emotion, behavior, it goes back to that again. But I'm seeing it now that it's lingering. Plus, they're not wanting to talk to anybody. I got that because that's kind of common sense. But I'm noticing that in that inability to talk to people, they're totally shut off. That's the part, that's the time when we got to really look at getting them to the next level of care, whether it is to now set up something within the clergy world or whether to take them and get them into something professional where now they're seeing a therapist, a psychologist, a psychiatrist, whoever is in that area in line. Having a conversation with the person also is very important because you mentioned it earlier. We say to people, come on, let me pray for you. You know, God's going to heal you. He's Jehovah Rapha, the Lord God, your healer. He's got you. But then the person says, okay, I prayed, but I'm still feeling the same way. I still need help. That's when we got to realize, okay, let's get you to the next level of care, which is get you to see somebody professional. So when I look at the part where it starts lingering over time, you know, we look at depression. So what we say for depression on the diagnostical side, that when it lasts 4 weeks or more, that's when we start looking at it for a diagnosis. Okay. So those kind of things we see. But if a person, once again, is not a clinician, not in that area, I would say from a church's standpoint, for a pastor or for lay members, if a person has it lingering and you see it going over 3 days, then yes, we need to have conversation about them seeing somebody professional.
Thank you, Dr. Tracy. I've got a load of questions myself popping in my own head, and I wish I had another hour with you. I'm really sorry that we have to bring this to a close. We have to respect the time that we have set aside, and I believe others have other appointments that they have to go to. But this has been really an enriching time. And for those of you who are with us, you know, one of the other things that we would really like to do is to see if we can do another session along with Dr. Tracy and maybe some of the other resource people. So I'm just going to put out a poll for you. And if you wouldn't mind answering that question, that would help us to organize a second follow-on session. Because I believe, you know, from the number of questions that I received, and there are some that we couldn't pick up, there is a load of stuff that we would really like to learn much more about. So it would be great if we can have that opportunity. And we would like to open it to others to let us know if you wish to, and we'd be happy to post that. So do answer that poll and let us know whether you would have it. We will also be sharing the recording of this. And if our resource people do not mind, also the slides, if possible, with our participants in terms of the follow-on of this. So thank you once again, Dr. Tracy. That was really a very stimulating discussion. I loved it myself. Thank you so much. Thanks for your time. And let me hand you over to Reverend Bijoy, who is the chair of our communications committee and also one of our vice presidents, to bring this to a close.
Thank you.
Bijoy, over to you.
Hello, everyone. I greet you all in the name of our Lord and Savior Jesus Christ.
I'm wondering whether I'm in the UN.
We are mini UN in the Asia Pacific. Thanks to our resource persons, Dr. Nori Delapes Lequan and Dr. Tracy Daniels. It was an eye-opening and thought-provoking presentations, as this is the need of the hour. In fact, maybe we are a little late in this, but better, I think, late than never, right? Let me share this, my personal experience. On 4th of October 2020, I got infected by the COVID-19 virus for the first time and went on quarantine for over 21 days.
Wow.
No symptoms, but completely isolated in one single room for 21 days. And on 7th of November 2020, just after 1 month, I tested again and discovered that I am COVID-19 positive again. This is for the second time. This time, I developed some symptoms and I got admitted to a hospital. It is a private hospital, but owned by a Christian family with missionary zeal. 7 days I stayed in isolation, all alone in hospital in a small room. The doctors and nurses ministered me. But after 7 days, my elder daughter, Andrea, she came there and she stayed with me in that room and she took care of me. Because after 2 days of my being detected as COVID-19 patient, my wife Sylvia, my two daughters, Andrea and Ivana, also tested positive, COVID-19 positive. They developed mild symptoms. They were also admitted in the hospital. We four were admitted in the same hospital but remained in isolation in separate rooms, could not see each other. We could hear each other's coughing but could not go and help even to give a glass of water to one another. I had to stay 22 days in hospital, 11 days in oxygen support. My lung was affected. Altogether, our family stayed 37 days in hospital. Our house was sealed and declared as containment zone by the government. It was published in newspapers and announced loudly in the PA system all over our locality, right? And let me tell you, to get a clearer picture, the amount for treating in the hospital was around average of around $270 per person per day, which is over USD 1,000 per day for the entire family. I was gasping to breath, and imagine what was going through my mind. Primary grief, secondary grief, tertiary grief, just imagine. And breaking the set protocols, I got discharged from the hospital even without testing COVID-19 negative, because after 22 days, we could not bear the burden of the hospital cost anymore. We came home, and after going through RT-PCR test every alternate day, thinking that I'll be negative, right, from home, we brought the paramedics at home. We invited them, and they came, and of course it is on payment. And every time, alternate day, I did for around a dozen of times. And finally, my COVID test report was negative on 7th of December, exactly after 2 months from the first time I tested COVID-19 positive. But post-COVID health situation, family situation, social situation, economic situation, ministry situation continued for months. Even now, today, after 4 or 5 months, I suffer from some post-COVID sequel syndrome. And I'm sharing this in detail with you all as my co-workers in Christ, so that you can imagine the grief situation we were in, both primary and secondary. I am sharing this because we are talking about this important topic today as ministers, as caregivers. We were in this situation, we are in this situation, but we know God has a purpose in this. And you know, ironically, I am a WHO certified, WHO, World Health Organization certified personnel on COVID-19 methods of detection, prevention, response, and control under the Health Emergencies Program, and passed that exam with 100% score. That's the irony. And I'm also the nodal officer for COVID-19 response task force of our residential complex, where we have around 160 families with over 700 population. And many people suffered in our complex. And being the nodal officer for COVID-19 response task force, I was in the front line to help and minister to the victims. And maybe during that time, COVID-19 virus transmitted to me. Though I took the required precautionary measures, maybe somewhere, sometime, I was caught off guard. Therefore, while ministering as pastors and caregivers, it is crucial to prayerfully take good care of ourselves. As Dr. Nori Delapage has mentioned. It is important to keep in mind what Dr. Nori Delapage mentioned in her parting words in exploring how to manage secondary grief through the eyes of the scripture. Self-care, meaningful conversations, respect time, nurture our faith, God out of the box. Remember this. these 5 key points shared by her from the biblical perspective. And keeping that in mind, as ministers and caregivers, let us apply the suitable strategies and anxiety-reducing tips like cultivating gratitude, being kind to yourself, deciding on a regular sleep schedule, etc., shared by Dr. Tracy Daniels to reduce symptoms related to secondary grief due to COVID. On behalf of APBF, I extend our profound thanks to Dr. Nori Delapage and Dr. Tracy Daniels for sharing their expertise to us. And even as a primary victim, I realize how important it is. As a primary victim of primary and secondary grief, I know how important for us as caregivers and ministers to understand and apply these steps in and around us as we minister. As the COVID situation is turning grimmer by day, with various countries reporting large number of cases daily, let us be more sensitive to the need around us, and importantly, be more sensitive to God's call as his servants to minister as Jesus do. Jesus brings life to people and gives us the privilege of being involved in what he is doing. People around us are grieving. They are the victims of fear and anger and anxiety, and some are spiritually dead. Based on the sharing by our resource persons, please think, what are some specific ways that we and our Christian community can represent Jesus to showing care like he did? May Lord Jesus bless you and protect you as you continue to be his hands, eyes, and ears. God bless you.